Brian Thompson was the CEO of UnitedHealth Group, one of America's largest health insurance companies. His murder in December 2024 in Manhattan sent shockwaves throughout the business world and sparked a broad conversation about the healthcare industry, social security, and violence in society. Thompson's death also raised important questions about the future of both the company and the healthcare insurance sector. Known for his leadership in the health insurance field, Thompson had successfully guided UnitedHealth to tremendous financial growth. In the aftermath of this tragedy, the developments surrounding his death, along with the underlying structural problems in the industry and broader societal injustices, were brought to the forefront. Thompson led UnitedHealth from 2017, strengthening the company's role in the healthcare insurance industry. Under his leadership, UnitedHealth made significant investments in health insurance, hospital and clinic services, prescription drugs, and digital health. However, Thompson's tenure also brought the company face to face with some of the industry's larger problems and critical issues. These included high premiums, low reimbursement rates, and limited access to healthcare for low-income populations. His death, therefore, was not just a personal tragedy, but also highlighted the deeper crisis facing the sector. The event took place near UnitedHealth's office in Manhattan. Thompson was ambushed by an assailant as he entered his office early in the morning. The security camera footage captured the incident, and the assailant's identity wasn't immediately clear. However, later investigations revealed that the attacker had left a message behind. The message criticized the profit-driven approach of health insurance companies. This wasn't merely an assassination, it was a larger societal critique of the healthcare system.
The motives behind the murder are still unclear, but evidence suggests that it was a planned attack, and the reasons likely stemmed from a deep-seated anger over Thompson's policies in the health insurance sector. Many critics argued that Thompson's efforts to make UnitedHealth more profitable included decisions that made healthcare less accessible for many people, particularly those in low-income groups. This incident has since prompted a reevaluation of how health insurance companies operate, and more broadly, how the system itself needs to change to be more equitable. While the full motives behind the murder are still being investigated, it's clear that the incident was not simply the result of a personal vendetta. The security footage showed the assailant leaving behind a message that criticized health insurance companies and their profit-driven motives. This message was part of a larger critique of the healthcare system itself, which is seen by many as focused on profits rather than patient care. The murder of Thompson has sparked debates on whether the healthcare industry, particularly large insurance firms like UnitedHealth, needs to shift its focus from profits to a more patient-centric model. Many people on social media viewed this assassination as a direct message against the healthcare industry. Social media users have widely discussed the need for insurance companies to operate with more transparency and fairness. These discussions have grown into a larger movement, demanding that health insurers prioritize patients over profits. This sentiment reflects the growing dissatisfaction with the current healthcare system, where high premiums and limited access to care have become major concerns. Following Thompson's death, movements and protests emerged demanding reforms in the healthcare system. Activists have rallied for more equitable healthcare practices, advocating for insurance companies to provide better services for low-income populations and to be more transparent in their pricing. However, despite these calls for change, the powerful influence of the insurance sector and the complex nature of the U.S. healthcare system makes it difficult to implement such reforms. This tragedy not only sheds light on the shortcomings of UnitedHealth and other insurance companies, but it also underscores the need for broader systemic change in the healthcare industry. Many are now calling for a shift toward a more patient-centered approach, rather than one that prioritizes profits. In this light, Thompson's murder serves as a stark reminder of the urgent need to address the deep inequalities within the system.